Namaskara. Welcome to the live phone-in program. I am Dr. Yashaswini, moderator for today's session. Every year, 16th April is celebrated as World Voice Day. This year's theme is Lift Your Voice. This day is commemorated to raise awareness about the value of speaking in our daily lives. It also encourages people to make effective use of their voice and cultivate good vocal habits. As part of commemoration of World Voice Day 2022, our topic for today is voice care in children. The objective of this program is to spread awareness on voice disorders seen in children and its treatment, ways and means to prevent voice problems and encourage good vocal habits in children. We have with us two experts in the field of voice disorders, Dr. T.K. Prakash,
Hello.
Professor, Department of ENT, All India Institute of Speech and Hearing, MYSURU, and Dr. Gopi Shankar R, Research Officer, Department of Clinical Services, All India Institute of Speech and Hearing, MYSURU. Our live phone-in program is for 1 hour from 2 p.m. to 3 p.m. So you can call and ask your questions on 0821 250 2536. I repeat 0821 250 2536. We are broadcast live on our official Facebook and YouTube channel AIISH MYSURU. So let us start the program. Before we learn about the voice disorders in children, I would like to request Dr. Prakash to give us some information on how is the development of voice in children from birth to teenage years. Sir?
Yeah, we should know how the larynx means the voice box which produces the voice. So for adults, the larynx will be in front of the neck. But in case of children, the same larynx or the voice box will be still more in the upper level. So whenever the child wants to talk, whenever the child wants to make a noise, it will be a different type of noise compared to that of the adult. The total length of the larynx will be shorter in case of infants, and the larynx or the voice box in case of children is slightly a miniature of the adult larynx, and it will be placed in the higher part, and some of the anatomical structures will be different. So in the vocal cords are the small strings like things. When they vibrate, they produce the voice. So this structure will be different in case of children when compared to that of the adults. So as the age advances, by about 14 years, the larynx will gradually change from its miniature larynx to an adult larynx, so that all the muscles will develop more, all the musculature will be developing more, all the bones and cartilages will be becoming wider and strengthier than that of the infant. And whenever the infant or whenever the child in the younger age group speaks or whenever it produces the voice will be different quality. It will be more shrilling type of voice. So we tell the fundamental frequency or the frequency by which the voice is produced is very high. It will be, the vocal cords will be vibrating at about 400 cycles per second in case of small children, that is in the infants, and gradually it will come to about 250 when they come to about 14 years of age. So that gradually the anatomical structure, this is the larynx what we are seeing here. So gradually the structure will become the adult size, and the small larynx will become a wider larynx, and entire anatomical structure will change. So that will cause voice changes as the teenage advances.
So Dr. Prakash is saying that in infancy the voice will be of a very high pitch, and as the child moves towards adulthood, it will become more of a lower pitch. Okay. Sir, Dr. Gopi Shankar sir, could you tell our viewers when do you call a child to have voice disorders?
Okay, when we have to say, when do you call it as voice disorders in children, or when you can identify there is a problem in voice? Before that, we should understand normal, when we have to say it is normal, then if we understand when we have to say normal, then we can understand when we have to say abnormal. Okay, sir has explained neatly about how the larynx develops. Okay, so when we talked about when we say infants, it will be high frequencies. Okay, why we talked about high frequencies? Voice usually measured in three aspects. We call it as technically pitch, loudness, and quality. So pitch is nothing but how we sound. When we speak, how we sound. For example, male is sounding usually in a lower pitch. Females and children usually they sound in a higher pitch. Okay. So and quality, when we say the quality should be clear, crystal clear. When somebody speaks, it should be crystal clear. If there are any changes in the quality of voice, then it will affect. Okay. So with respect to children, if there are any problem in these three aspects, if it is in pitch, there is a change in pitch, or they are unable to speak in appropriate loudness, or the quality, when we say quality is if ಕನ್ನಡದಲ್ಲಿ ಗರ್ಕಶ ಅಂತ ಹೇಳ್ತಾರೆ, or if you say force component or breathy component, if you see in your voice, then it can be called as child is having a problem in voice.
So any modifications or changes in pitch, loudness and quality which is away from typical.
Yes, okay, yeah.
It is called as voice disorders in children.
Yes.
Okay, now Dr. Prakash, what are the causes of voice disorders in children?
Yeah, voice disorders or change in the voice can occur due to some congenital abnormalities. Congenital means whatever the anatomical structure, the structure of the larynx should be there. There will be some difference in the anatomical structure, and it will be by birth itself. So whenever the child is born, so we call them as infants up to 1 year of age. So during that period, if the cry is abnormal, or whatever the sound that is coming from the throat is abnormal sound, then we have to examine the larynx and see whether there is any congenital defect. Congenital defect means any difference in the normal anatomy of the voice box. So by examination of the children, we can be able to see whether there is any anatomical abnormalities there in the normal anatomy. So after that, as the age advances, there will be acquired conditions. So acquired means because of the improper usage of voice. So if there is a vocal abuse, what we call it, the normal child, when it speaks in the normal voice, then it will be okay. If it speaks in an abnormal voice, suppose if it shouts or screams and all, there will be some changes in this vocal folds. So there will be anatomical abnormalities will be there. There might be formation of some small nodules like this. So that will cause some difference in the voice. So this is called a vocal nodule or a vocal cord polyp, like that. So anatomical changes will occur in the vocal folds. See, these two are the vocal folds. So you can see small swelling at the vocal folds. So if it occurs like that, there will be change in the voice. So these are the acquired conditions. Along with the acquired condition, whenever there is a upper respiratory tract infection, if the child is having any common cold, fever and all, gradually whatever the vocal cords which produces the voice, they will be swollen up. They will become more in size. Then also abnormality will be there. And there are so many other conditions. Whenever the neurological abnormalities like vocal cord paralysis, the vocal cords has to move with every phonatory, that means every whatever the voice that is produced, it has to move. In vocal cord paralysis, only one cord will be moving and one will be stagnant, or both will be stagnant, so that the voice is not produced, or produced voice is breathy. So there are many reasons for the change in the voice in case of children, and that has to be evaluated by doing an examination.
Dr. Prakash, expanding on this aspect, can you name some of the medical conditions which are seen in children at birth that can cause voice disorders in children?
Yeah, medical conditions which can be seen during birth itself, that is from congenital anomalies, will be there. So they are what are known as laryngomalacia. Laryngomalacia is a condition where if there is normal stiffness of the larynx, the voice will be coming. If the stiffness is lost, whatever the musculature is there in the upper part of the larynx, that will fall into the airway, and there will be a different kind of voice. or else there will be some anatomical abnormalities like vocal cord cysts. Cyst means small swelling will be there, or the cord movement will be not there, as I have told, vocal cord paralysis, or there might be some swellings, blood collected swellings, we call it as hemangiomas, and some chromosomal abnormalities where the normal structure of the larynx is not there, like Reed-Richards syndrome. Some of the chromosomal abnormalities will be there, and there is one condition what is known as laryngoscene. So in this condition there will be air-filled sacs will be there inside the laryngeal structure. All these things can cause hoarseness of voice, that is roughness of the voice. The normal voice which is coming will be altered. So that will come under voice disorder, and we have to evaluate and we have to give proper surgical treatment for these conditions.
Now, as Dr. Prakash was pointing out, children can have voice disorders when there is structural differences or structural anomalies in the structure of the larynx or voice box. Now, let us ask Dr. Gopi Shankar whether these there can be voice disorders even when there is no structural anomalies. Sir?
Yeah, what you mean is you mean to say is that any emotional trauma can affect voice, right?
Yes.
Okay, see what happens normally when we speak, we speak out with our emotion. For example, we are happy, we are projected through our voice. We are sad, everything, whatever mood we are in or whatever emotion we are in, it is reflected in our voice. Okay. If something happens emotionally, which will definitely affect our voice. For example, if something we are expecting to be good and it doesn't happen good, automatically it will be reflected in our voice. In case of children, if we see, they are more prone to have such problems. Okay, if there are anything which affects in the family structure or any emotional trauma that happens in the family or to him, it can lead to something called functional aphonia, we call it as, or psychogenic voice disorder, we call it. Okay, it can happen.
We'll hold on with that thought and take a call.
Yeah.
Hello. Hello. Good afternoon. You're speaking on the live phone-in program. Dr. Gopi Shankar is right here. Please ask your question.
சொல்லுங்க.
Could you
கொஞ்சம் லவுடா பேச முடியுமா? தமிழா பேசுங்க. கேக்குது, சொல்லுங்க. ஓகே. ஓகே. ஓகே, இப்போ வந்து நீங்க ஆக்சிடென்ட் சொன்னீங்க. ஆக்சிடென்ட்ல வந்து அவன் வந்து கத்திட்டான்னு நீங்க சொல்றீங்க இல்லையா? அவனோட நெக் போர்ஷன்ல அந்த மாதிரி நம்ம பேசுற பகுதியில கழுத்து பகுதியில ஏதாவது அடிபட்டு இருக்கா? ஓகே. ஸோ பொதுவாக வந்து இந்த மாதிரி இருக்கும்போது ரொம்ப வந்து அப்யூஸ்ன்னு சொல்லுவோம், அதாவது ட்ரோமேட்டிக் கண்டிஷன் சொல்லும்போது அப்போ என்ன ஆகும்னா நம்ம லவுடாக வந்து பண்ணும்போது என்னன்னா அந்த குரல் நான்குன்னு சொல்லுவாங்க. அந்த குரல் நான்குல வந்து ஒரு சில டைம் வந்து ப்ளீடிங் ஏற்படுறதுக்கு இல்லைன்னா ரப்சர் ஆகிறதுக்கு சான்சஸ் இருக்கும். ஓகேவா? அந்த மாதிரி கண்டிஷன்ஸில் வந்து என்ன ஆகும்னா ஸ்வெல்லிங் ஆகுறது, அப்புறமேட்டு அவங்களால ஒழுங்காக பேச முடியாது இருக்கிறது, பெயின் இருக்கிறது, இந்த மாதிரியெல்லாம் வர சான்சஸ் வந்து ரொம்ப ஜாஸ்தி இருக்கும். ஓகேவா? ஸோ இமீடியட்டாக நீங்கள் பண்ண வேண்டியது என்னன்னா இஎன்டி சர்ஜன் இருப்பாங்க, காது மூக்கு தொண்டை நிபுணர்னு இருப்பாங்க, அங்கே பக்கத்தில் யாராவது இருந்தாங்கன்னா அவங்கள்ட்ட போய் அவங்க பார்த்துட்டு ஏதாவது மெடிக்கலி ரிலேட்டட் கண்டிஷன்ஸ் ஏதாவது இருந்ததுன்னா அவங்க வந்து என்ன ப்ரிஸ்கிரைப் பண்ணுவாங்களோ அதை வந்து ஃபர்ஸ்ட் நீங்கள் எடுக்கணும். அதுதான் வந்து ஃபர்ஸ்ட் பிரைமரி ட்ரீட்மெண்ட். ஓகேவா? அதுக்கப்புறமேட்டு வந்து அவங்க வந்து சஜஸ்ட் பண்ணுவாங்க நெக்ஸ்ட் அப்படியும் ட்ரீட்மெண்ட் ப்ரொசீஜர்ஸ் எல்லாம் முடிஞ்சு மெடிக்கல் மேனேஜ்மெண்ட் முடிஞ்சு ஏதாவது தேவைன்னா அவங்க வந்து வாய்ஸ் தெரப்பின்னு வந்து அவங்க சஜஸ்ட் பண்ணுவாங்க. ஓகேவா? அது ஒரு ஆப்ஷன் நீங்கள் பண்ணலாம். இல்லை உங்களுக்கு அங்கே எங்கேயும் இது பண்ண முடியல அப்படின்னா நீங்கள் டைரெக்டாக வந்து ஆர்டினரி ப்ரொஸ்கிரிப்ஷன் வந்தீங்கன்னா நாங்கள் வந்து டீம் ஆஃப் ப்ரொஃபஷனல்ஸ் இருக்கோம். ஃபர்ஸ்ட் வந்து இஎன்டி டாக்டர் பார்ப்பாரு, மெடிக்கல் மேனேஜ்மெண்ட் ஏதாவது முடிச்சதுக்கப்புறம் அப்புறமேட்டு அவர் வந்து ஸ்பீச் லாங்குவேஜ் பத்தாலஜிஸ்ட்ன்றது வந்து ரெஃபர் பண்ணுவார். இதுதான் வந்து அவங்களுக்கு டைமிங்க்கு ஒரு தேவை. ஓகே, இங்கே இஎன்டி டாக்டர் இருக்கார், அவர்கிட்ட நீங்கள் ஏதாவது கேட்க விரும்புறீங்களா? வேற ஏதாவது கேள்வி வேண்டியது இருக்கா? ஓகே, தேங்க்யூ கமலா சார். See, actually, what happened? He was asking about his friend was met in an accident. Okay, on emotion, we are talking about emotional shock. Okay, so what he did due to that incident, he has shouted or he has screamed. Okay, so after that, he has the voice is reduced, the loudness is reduced. So he was asking what could be done for the problem. So that's what I told him. First, you need to meet a ENT surgeon first to see if there are any anatomical changes happen in the voice. Okay, that's what we ask. First line of treatment would be always medical management in such conditions. Then, based on that, SLP is considered. So, do you want to add on something on that?
Yeah, whenever the accident is there, whenever he shouted after seeing that accident, there will be what is known as trauma to the vocal cords. So this trauma will cause some hemorrhage. So some bleeding will be there in the vocal cords and there will be swelling. So first we have to treat this swelling if it is there. Then only we have to give him psychological therapy and all. If it is not there, we have to give him psychological counseling and then we have to treat him. So if there is any structural abnormalities, that has to be treated, and if there is no structural abnormalities, he has to be treated by a speech language pathologist by giving him voice therapy.
So in this case, probably both of you will agree if I say it is a combination of probably both structural problem and emotional.
Functional and emotional. Yes.
So moving ahead, our experts have already answered this, but I would like to specifically ask, if parents suspect voice disorders in children, then where do they have to go and whom do they have to consult?
See, when sir was talking about upper respiratory infection, commonly seen as tonsillitis, common cold. So all these problems also can lead to some amount of voice problem. Okay. First is always you should see a ENT surgeon. Okay. First consultation should be with ENT surgeon. Okay. He will examine the vocal folds or he will examine the larynx. He would suggest what would be the next step or wherever the required referrals are there that they will make based on their observation. Okay. So first they should meet the nearest ENT surgeon whoever is available.
So the first link for voice disorders with the professional is ENT surgeon. So Dr. Prakash, how are voice problems treated medically or surgically?
See, whenever the patient come to us, that is whenever the kid or the child will come, so the parents will tell the child voice is changed. So then we will listen to the voice of the child. Sometimes we can get some clues.
We'll hold on to that thought. Hello? 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 Could you please speak?
Yes, ma'am, can you hear me?
Yes, you are on the live phone-in program. Kindly ask your question.
Yes, ma'am, this is Krishmita speaking.
Yes, Ms.
So,
Sushmita.
last week, because I had pain my talking, I had gone to the ENT.
Okay.
So then the doctor told that I have acidity and my muscles have become tight.
Okay.
So he put me under medication for that.
Okay.
Yes, and 1 second, the medicine is Serazole.
Sorry? Medicine? Okay. Dr. Prakash? You can speak to our expert. Dr. Prakash is online.
So only that medication is given or any other thing is given?
Just that, doctor.
Only that one? Yeah, when they have examined your larynx and they have told that there is some acidity, that acidity has to be treated. So what happens is, whenever the acid comes from our food tract to the larynx, it will regurgitate. The acid will come from the stomach, it will regurgitate and burns the back part of the larynx. So there will be voice change, and also redness will be there in your vocal folds. So this has to be treated with what is known as PPIs, that is for gastric treatment we are going to give them medicines. So similarly they have given you the medicine, but along with that you have to follow some of the precautions to avoid this what is known as gastritis or GERD problems. So gastroesophageal reflux disorder, we call this kind of conditions where the acid will burn the vocal folds and cause voice changes and pain while during speaking. So along with that, you should follow some of the things. What I suggest is you should take the meals and breakfast everything time to time. So every day you should be more punctual and regular in the timings of taking the food. So whenever you take the food in the night, that is after dinner, you should not immediately sleep. So you should at least wait for 1.5 hours to go for sleep, that is to go for bed. So whenever you go to bed, you should have a bigger pillow so that your head end should be in the upright position or slightly higher level than your body. So the regurgitation of the acid material cannot occur and it cannot burn your larynx. And the meals, that is the dinner, what you take in the night, it should be off the stomach. You should eat it like a poor man. So that will prevent this acid regurgitation. So you should follow all these things. Along with that, you should avoid coffee, tea, all those beverages and also spicy things. So along with this, the medications, the proton pump inhibitors, what I was telling, the PPIs and also edema reducing things. That is, whatever the swelling is there, that can be reduced by some medicines. So all these things you have to take it for 1 to 3 months duration. Then once again we will examine the larynx and see whether there is redness or not. So you should follow all these things to get rid of these things, this GERD problem. Okay?
Okay. Doctor, what about the tightness with your muscles are tight?
Because of the inflammation, whatever the structures that are there in the larynx, they become more stiff. That's why your voice would have been changed. So we call it as some muscle tension dysphonias and all. So that can be relaxed. So if you consult a speech language pathologist, they will teach you some exercises or massages so that whatever the tightness of the muscle is there, that can be relaxed. So only when we examine the larynx by what is known as stroboscopic examination, we will come to know the tightness of the muscle and how these muscles are acting. So after seeing that, we will recommend you to a voice therapy which can be given by a speech language pathologist so that your laryngeal musculature will get relaxed and your whatever the normal voice will come back. Okay?
I hope that answers your questions, ma'am.
Yes, sir.
Okay, thank you for calling.
Thank you, sir.
Okay, so our doctor was telling that one of the causes might be acid reflux
Yeah, acid reflux.
for voice disorder.
Yeah. What we call it as GERD,
Okay,
gastroesophageal reflux disorder,
okay,
or a laryngopharyngeal reflex. All these things will burn the back part of the vocal folds and it will cause voice change.
okay. So, doctor, is it seen in children as well? Children as well? Doctor?
Yeah, it can be seen in children also.
Because children are eating junk all the time, so.
Yeah, sure. Spicy things, all those things, they can cause all this.
Thanks, doctor. We were discussing about the medical and surgical treatment for voice disorders, doctor. Can you continue?
Yeah, whenever there is a congenital anomalies, we have to treat that. If there is a laryngomalacia, whatever the flaccidity of the muscles that will be there above the larynx, that has to be trimmed off using a surgical method. Either it can be a cold knife or a laser, like that we can use many other methods. And if there is a vocal cord paralysis, we can wait for some time if it is not an urgency, and then we can do a suitable appropriate procedure. In case of lateralized cord, that means whenever the vocal cord is in the most side position and there is a breathy voice, we can push the vocal cord into the midline position and make the voice more better. Or if there is any swelling like cyst or a laryngocele, that can be operated and taken off.
Okay.
In case of acquired abnormalities, as I was telling, if there is a polyp like this, see here is a polyp. So this will be causing lot of disturbances in the voice production, because these two come and approximate. These two are the vocal folds. They come and approximate in the midline, so that a clear-cut voice is coming. But whenever there is a swelling like this, so it will impede the whatever the closure of the vocal folds is not possible, because this thing is in the middle. So we have to remove that by using surgical methods. So these are some of the surgical methods. Other than that, medically, how we treat the conditions is by giving medications in case of upper respiratory tract infections, or in case of chronic conditions, chronic laryngitis, and as we were discussing a GERD problem, all these things can be cured by giving medications itself. So many chronic laryngitis cases. Suppose if the patient is having tuberculosis, that will affect the larynx. So if you give just anti-tubercular medications, then automatically without surgical interruption, without surgical intervention also, we are able to cure the conditions. In case of that is thyroid anomalies. So whenever there is a thyroid toxicity or low hypothyroidism, and if you give a medications, automatically the voice will improve. If a hypothyroid patient is there, their voice will be rough due to edema of the vocal folds. So if you give a thyroxine hormone, automatically the normal vocal cords will come and the voice will improve. Like that, there are medications also, there are surgical methods also. So after examining the patient for a suitable treatment modality, we have to employ that whatever the treatment modality is there, and we have to treat the patient.
So based upon what is the problem in the patient, what is causing voice problem, that is evaluated, and suitable medicines or surgical intervention.
Sure. First evaluation has to be done, and then only we can choose the treatment.
Okay, thank you, doctor. Now let us ask Dr. Gopi Shankar, when there is no structural anomalies, or when there is no emotional disturbance, or when there is no GERD, are there any other causes that can cause voice disorders in children, like bad habits like screaming and other things?
See, most of it, what happens, if you see the children, they'll be screaming and playing, okay, that's how they enjoy their play activity. So that screaming also, there is a limit for screaming, okay. See, commonly what we see nowadays, children who play, who cry, they do everything, excessively. They cry excessively, okay. Just to get something, if they are not given by the parents, they do excessive screaming, okay, or excessive crying, okay, which is commonly technically called a misuse and abuse, okay. So what do? They excessively scream and they excessively use their voice, okay. So it's purely a functional problem. Functional problem, what I mean is they use their voice extensively.
Please hold on to that.
Yes.
Hello. Good afternoon. Yes.
I'm a dentist graduation.
Yes, ma'am. Ms. Devyani, please.
Actually, when client came in my clinic,
Okay.
he came for the purpose of braces.
Ms. Devyani, can you please speak a little louder?
Okay. So he came for the purpose of braces to my clinic.
Okay.
Okay, but I noticed that he had some voice issues.
Okay.
So I wanted to know, like, how should I recommend to your hospital?
Okay. Dr. Gopi Shankar will answer.
Ma'am, if there is any, this is Dr. Gopi Shankar speaking, a speech language pathologist.
Yes.
Ma'am, if you feel that if there is any changes in voice quality or any changes in the voice how you perceive, with the person, you can directly send them to All India Institute of Speech and Hearing for further detailed assessment. Here what we have a team of professionals who will see him, and if there is a problem exists, we will assess them. Okay, then we will give a proper guidance for further treatment procedures.
So do they need to take appointment or they can come directly?
Now there is we have a portal www.AIISH.in. We have a centralized appointment portal. It is available.
Okay.
they can fix an appointment from there and they can visit us, ma'am.
Okay. So actually the patient is Mumbai based. So I wanted to know the online assessment is possible or not.
Ma'am, I think we have a department called Telecenter for Persons with Communication Disorder, again, which is available in our website.
Okay.
You can contact them, and I think based on appointments, they do assess patients,
Okay.
persons with communication disorders.
Online only on the website I can get the details.
Yes, madam. You have to look out for Telecenter for Persons with Communication Disorders
Okay.
in our website portal.
Yes, sir.
Towards the end of the program, I will give you the details, ma'am. Kindly join us.
Okay, fine. Okay. Thank you.
Thank you. Thank you.
Yeah, we were just talking about the children apart from structural other issues, emotional issues. So what happens when they use their voice, extensively, when they misuse and abuse? There are high chances that they will get a condition when Dr. Prakash was explaining as vocal nodule. Okay, they tend to develop vocal nodule, and ultimately they'll end up having voice problem. Okay, when they have such problems, we can treat through voice therapy. Okay, again the procedure is they'll be consulting a ENT doctor for confirmation of the problem. Based on the problem, they'll be recommended for speech language pathologist for voice therapy. Vocal nodule definitely can be corrected or resolved through voice therapy.
That's a good information to our viewers. That if there is a voice problem in children because of excessive usage of voice or abuse of voice, then it can, in some conditions, it can be treated through voice therapy. So, moving ahead, Dr. Prakash, for our viewers, can you please explain the procedures that are carried out to test the voice, and what's the approximate duration that it can take for evaluation of voice?
Okay, we want to evaluate the patient who has come to for his voice checkup. So first we will talk to them. Just by talking to the patient and by listening to the voice, we will be able to come to some light where we should examine and all. So some conditions can be made out by just how the patient is talking, whether his voice is breathy or whether he is holding it very tightly. All those things will give us an idea this might be the condition. Or whenever there is a breakage, we will come to know there is some lesion in the thing. All those things. So by just that will give a rough idea. After that we are going to do some procedures, or we are going to examine the larynx. So we will examine his oral cavity, that is the mouth, all the lips, teeth, everything we will examine. Then we will go and see the voice box, larynx. So this can be done by doing what is known as endoscopic examination, which is nowadays it's a trend. So we will put what is known as a rigid endoscope or a flexible endoscope. In case of children, it is very difficult task to put a rigid endoscope, and it is better to use a flexible endoscope. So the children through the nose we are going to put this flexible endoscope, and this will go and sit above the voice box. So when the child is asked to phonate, that means if he is asked to say some E or A like that, any voice, so we will be able to see the movement of the vocal folds, whether it is coming properly moving or not, and we will be able to see some structural abnormalities also. If there is a vocal nodule, as Gopi Shankar doctor was telling, if there is a vocal nodule like this in children, because of the screaming, lot of screaming, shouting, this kind of small swelling will occur. So that can be seen through the stroboscopic examination. So we will come to a conclusion that this is a case of vocal nodule. And if the duration of this disease was only about 1 month or 2 months, and by seeing the vocal nodule only we can come to conclusion whether it can be treated with a voice therapy or whether it needs a surgical intervention. So early vocal nodule, where the nodule is appearing very much fleshy, it can be treated 90% by just giving voice therapy. The proper voice therapy by a speech language pathologist will cure the vocal nodule in the earlier stage. Suppose if the duration was more than 6 months or 1 year, and by seeing the vocal nodule, if it is appearing very hard, firm, and a whitish mass is there on both sides of the vocal cords, then probably this vocal nodule is not cannot be cured by voice therapy, and it has to be taken for surgical removal. But a trial voice therapy can be tried for 1 month or 1.5 months. Even then also, if it is not coming down, we can go for surgery. Like that we will decide. Other than this vocal nodule, we can get some polyps. So if you see this picture, you can see a more fleshy swelling. A fleshy swelling is there. This is a polyp. Probably there was a hemorrhage when the child shouted. There was a big hemorrhage, and all the whatever the mucosa that was covering the vocal folds became a mass, and it has formed a polyp there. So this has to be taken out because it is a very big. This has to be taken out surgically. Other than this, we can see so many conditions like vocal cord paralysis. See, if you see the vocal fold, this will be in the midline, and this is in the most lateral aspect. Lateral aspect means it is in the sideways. So in this case, we have to do some procedures what is known as medialization thyroplasty. So this is how we can diagnose the conditions. So whenever there is no structural abnormality, we will see that vocal folds or the vocal cords will be reddish. So it will be reddish because of some upper respiratory infection. So along with the examination of the larynx, we will see for other ENT problems, whether the child is having a running nose, or whether the child is having a tonsillitis or adenoids. Like that we will see for other conditions and see for the focus of infection where it is there, and we will treat that focus of infection, and gradually whatever the laryngeal infection is there, that will also will come down. So the stroboscopy is the latest method by which we can see the movements of the vocal folds and how the entire vocal folds will function. So we will come to see very miniature problems also very nicely in the stroboscopic examination, which is available in our institute, and every voice care patients, they will undergo stroboscopic examination. So stroboscopy is still a step ahead than the endoscopy. So endoscopy will tell the structural abnormality. The stroboscopy will tell both the structural and also functional abnormality of the voice. So the patient will be submitted to a stroboscopic examination, and both the modality of treatment, that is whether the patient has to be managed surgically or medically or by speech language pathologist, by voice therapy, all this can be concluded by doing a stroboscopic examination.
So, Dr. Prakash says that for medical and surgical procedure, first evaluation has to be done.
Yes.
That could be either flexible or rigid endoscopy, and the state-of-the-art procedure is stroboscopy. After all these evaluations are done, then the child can be recommended for suitable treatment.
Yes.
So, how long can these procedures take?
In case of children, it is a challenging task, and it will take some 15 to 20 minutes just preparing the child. We have to counsel the child. We should tell that we are going to put this, it doesn't cause any harm. Like that we should counsel the child properly, and then we have to take. Even then also some children will be uncooperative. So in those cases, the child has to be examined in the operation theatre under general anesthesia. In case of infants, in case of just born, this thing.
We'll hold on to that
Okay.
thought. Take this call. Hello. Can you please speak a little louder? Yes, you are. Divya, please tell your question. Okay. It's since a month he is having roughness. Okay. Okay. So he's how old? He's 8 years. Dr. Gopi Shankar?
Yeah, Divya, can you just give us information about how is this vocal behavior? Vocal behavior means how is vocal, or how does it play?
He's having younger children also, and then he speaks with his bearing.
Okay, see what happens usually in children when we are talking previously the questions. Most of the children they will have a habit of speaking loudly. Okay, excessive screaming. Okay, and excessive crying. All those things may lead to some kind of voice related issues. Okay, from where you are calling from, Divya? Okay, see what you can do is maybe probably you can visit the ENT person who's nearby you. You can just show it to them and look out for any changes in voice quality or any voice characteristics. Then the ENT person will guide you where to go. Okay, if there are changes in voice quality, you already said he's having some rough voice quality, right? Hello? So it's better to consult the ENT surgeon first. He will guide you where to go next.
Should we make any diet modifications?
So that is what, based on the consultation, they will provide, especially for children. Children first we have to see how the ENT doctor will give you a right guidance. So do you want to add on anything?
Yeah, first you should see that child doesn't scream or shout. Ask the child to have some vocal cord rest. So give the rest to the vocal folds. So you watch this vocal cord behavior, that is how he is speaking, screaming and all. Because this is the summer holidays and all, usually they will be enjoying like anything with screaming and all. So just avoid all those things for about 10 to 15 days and see for the how the voice changes. And if there is any upper respiratory infection, you treat that one. Then you can consult your doctor if it is not coming down.
Does it answer your question, Ms. Divya? Okay, thank you for calling. So, sir, we were discussing if in case of infants we have to give.
Yeah, in case of infants and all, in case of uncooperative children, in case of 3 to 4 year children where they are not able to undergo this endoscopic examination and all, we have to examine them under the anesthesia. So we have to take them to operation theater and see the vocal folds. Then only we will be able to diagnose it properly in case of uncooperative children. So if the child is cooperative, it is better to do an endoscopic examination.
So these were the ENT surgeon procedures for evaluating the voice.
Yes.
Now, Dr. Gopi Shankar, can you give our viewers information on how a speech language pathologist evaluate the voice of children?
See, when voice is concerned, see, as he rightly pointed out, the interview gives a lot of information. You would say technically a case history taking, okay? So interview with the patient and parents will give a lot of information about the vocal behavior, what the patient is exhibiting, okay? In different environment we can say, either the home environment or playground, okay, all in the classroom. Whatever the vocal behavior exhibiting, that can be extracted from the interview with the parents, okay? That is the prime and foremost thing SLP will do when the patient is walk into a SLP, okay? Why this is important? Because we will get to know about the vocal characteristics what he is exhibiting. In case of children, even in adult, this is very important. This gives almost 30% of the information to a profession. Okay, it can be a doctor, it can be SLP or whomever seeing with respect to voice issues. After that, what we do is there is something called, we need to extract some parameters. So initially, I told we basically three parameters in voice characteristics: pitch, and loudness and quality. Okay. So next to the SLP would do, there's something called perceptual evaluation. Okay, I have to judge based on a standard protocols we have. Based on that, how his voice quality is. Okay, based on the standard protocols we do. That is the second level. After the interview, we will go for a perceptual evaluation. Okay, perceptually how the child is sounding based on the standardized protocol. Okay, once that is done, then we go for instrumental evaluations. Okay, why instrumental evaluation is required? See, pitch, loudness, all can be measured. Okay, and we know the normative data. For example, as previously we told, male speak in a low pitch, and females and children speak in a high pitch. What we do is, if there are pitch related changes, we do get information while using an instrumental evaluation. Okay, all this information, pitch and loudness aspects, we can get it from instrumental evaluations. Okay, once all these things are done, the patient referred for an ENT consultation if they are not done for visualization of the vocal folds. Okay. Once this is done, the patient will come back to SLP if it is in a SLP setup. Okay. Otherwise, the patient is referred from ENT setup. Usually they come with the endoscopic reports and directly you can do it. Then the counseling, that is the crucial part where we tell the patient or the parents or caregivers what is the exact problem for the voice problem, problem. It is like whatever is present we are giving in counseling. In counseling, we will also would focus on how to prevent, okay, and what to be done. Okay, so there is something called vocal hygiene. Those tips are given at the consultation point itself. Okay, for example, the previous caller asked, the child is screaming for a longer duration. Okay, so I suggest for vocal rest or voice rest. Okay, with voice rest, what we can do is we can ask him to take a plenty of water. Okay, when we take plenty of water, it will hydrate the entire vocal tract. Okay, which will reduce the strain of the child or client. Okay, so this is the assessment steps we follow when they come to us for speech language assessment.
So first is the case history,
Yes.
then we will see how the voice is sounding and judge it by its pitch, loudness and
Perceptually, yes.
and then we do some measurements to know what is the exact number or
Yes. Yeah, normative. Yeah, based on the normative, whether it is within normal limit or it is in abnormal limit. Okay, all these things will be helpful. When we do the treatment program, we can compare whether it is improved or not improved. That's why all these steps are crucial.
Okay. So my next question is to you again, Dr. Gopi Shankar. Are these voice disorders that are seen due to excessive speaking, coughing, preventable? And if so, how can we prevent voice disorders?
See, most of the time, these all loud speaking situations. Okay. See, for example, you said coughing, throat clearing, excessive screaming. Okay, we cannot tell the child, you don't scream or you don't speak loudly, or for example, if the child is playing, they are interested to communicate and speak loudly or scream loudly and play. We should tell them how to do that. Okay, if we don't guide them or teach them the right way of doing, it's like we are depriving the child not to enjoy the play activity. Okay, that is in the nature of the child. Okay, we cannot stop them. You don't scream or don't shout. There is a way to shout. Okay, if they are doing such things, there are coaches for that. Okay, to do that. Okay, we also insist them. I previously told about the vocal hygiene tips. Those things need to be told to the parents. Okay, to be followed, and somebody should monitor, because if they are a child, they don't know how to do it. Okay, so somebody should monitor who is prone to have voice problems, or they are suspecting the child is having voice issues. They should be told what to follow and what not to follow. Okay, so that the child can be monitored.
So based on what the child is doing wrong,
Yeah.
we prescribe what is right.
Yes.
And monitor the
Yes.
same. Okay, thank you, doctor. Now, Dr. Prakash, moving from childhood now to puberty. At the time of puberty, voice changes are expected most noticeably in boys. Is that considered as a voice disorder, doctor?
It cannot be put directly as a voice disorder, because it is more of a physiological thing, where what we tell the condition is known as puberphonia. So the normal larynx, it undergoes some changes in case of boys. This is due to some hormonal influence. So whatever the normal structure is there, that will grow still more bigger in these teenage persons. So that whatever the masculinity to that voice, that will be from childish to masculine, it will become. So during that change, it is more of a physiological change because of the change in the volume of the musculature in the voice box. So at this time, it will be slightly difficult part for that some children to get adjusted to that masculine voice. So the child will, the patient will be speaking sometimes in the very low pitched voice and sometimes in the high pitched voice like a children. So that breaking of the voice, what we call, will occur. So it is more of a physiological thing. And when we want to treat that patients, So exactly we cannot put them as a disorder, but it is a physiological change that is occurring. So we can tell that patient, we can counsel the patient and give some therapy and psychological backup. All those things can be given, and gradually the voice will become a masculine thing. That is a normal physiological thing that is occur. And if Gopi wants to add something to this.
So that was my next
Yeah,
question.
see, usually is right, correctly pointed out. It's a physiological changes. Okay. See what happens usually. Most of the time, the wrong modeling or the appropriate feedback is not provided for such patients. If there is no problem with their, endocrine related issues or growth related issues, if it is not there, the child is developing normally. Okay, all those things are fine. Most of the time, what happens? The parents expect the child to speak like a child, normal child or a small child. Okay, though the child apparatus or the anatomically is grown well, or the changes are happened adult like, they expect the child to speak like how he used to be. This is something called baby talk they do. Okay, so they expect that they do it. Or what do they say? Usually, what I have observed in clinic is the parents or the friends say previously what you are speaking is very sweet for boys. Okay, so the child or the boy will understand that whatever is speaking the new pitch is supposed to be wrong, as the feedback is given from the environment. Okay, so most of the time that feedback is not given or not reinforced properly. If that doesn't happen, he will remain speaking the high pitched voice. Okay, when he goes to a similar age peer groups, that time he will get to know that I am not speaking like them. As long as he is not interacting with the peer groups, he will not get to know that he is speaking in a high pitched voice. That is where problem comes. Okay, it's also a physiological issue with an environment influence. Okay, so this can be treated through voice therapy. Okay, what it has done is basically most of the time they would be able to speak in both the pitches. Only thing is if the pitch is not reinforced or identified properly, they will continue to speak in the older voice. If it is identified and corrected with the technique, they will be able to speak like what is identified for adult male, that is a low pitch voice, they will be able to speak. It's purely curable.
They will match their physiology.
Physiology, yes, based on that height, weight, okay, and their structure.
So these teenagers' voice problems can be identified and treated by
Yeah,
voice
especially with respect to puberty.
That is transition of voice in boys from
Yes.
childhood to adolescence.
Adulthood, yeah. Speaking like a female voice when they are at the age of 14 years or 16 years. Okay. So colloquially it is called speaking like female. Otherwise, technically we can call it as high pitched voice.
So that is a good piece of information, Dr. Gopi Shankar. Now, can you give some information on? You mentioned about vocal hygiene tips. Can you elaborate more on that?
See, vocal hygiene, when we talk about vocal hygiene, there are two things we can majorly talk about in vocal hygiene. Okay. So when we say vocal hygiene, the first thing is about hydration. Okay, hydration I already told. You have to take plenty of water. Okay, when we say vocal hygiene, take a lot of water. We usually say take a lot of water, sip by sip, not in a bulk. Okay, throughout the day, if you are having entire day vocal behavior is there, that means you are speaking for a longer time continuously, then you take a sip by sip water which will hydrate your entire tract. That is one thing. Okay. And another thing is in vocal hygiene about SR is already described about GERD, the gastric related issues. Okay. It is not that only GERD is treated. It's all about our entire lifestyle and diet style. Okay. Okay, which can lead to a voice problem. Okay, so these two things are goes hand in hand. Okay, only if you take water and you take food inappropriately, that's not a good hygiene for voice. Okay, both should be go hand in hand. Okay, so that's in brief about vocal hygiene. Actually, usually what we do is vocal hygiene itself we give guidance on for 2 days it goes.
So that's about vocal hygiene. Doctor, can you give a take-home message for our viewers about?
Okay, see, being a World Voice Day, the take-home message would be anything what we do, we should use it, appropriately with whatever is required. We should use it. Even for voice, it's all good. Whatever is required, use the voice effectively. Use the voice how much is required. You use it. Just because you can speak and you can scream for whatever amount you can do, it should not be done. Okay, your voice is your identity. Okay, once you lose your identity, you will never get your identity back. Okay, it's not that it cannot be you will get it. You have to spend some money, spend some time. Definitely you have to consult so many people to get your identity back. So before you are getting into an issue, you can always prevent by using limitedly and effectively.
So use voice mindfully.
Mindfully, yes.
Okay. That was Dr. Gopi Shankar's take-home message. Dr. Prakash, do you have any take-home message for our viewers?
Yeah, what Gopi Shankar was telling, I want to just tell the same thing. Voice, lift your voice. The voice is very much precious. So you should use your voice like money. How you spend the money, you spend your voice also in the similar manner. So it is very precious. That's all I want to tell. If I tell it is you spend the voice like a money, then it is understood how precious it is. So voice is our identity, and just keep it up at all aspects. That's all I want to tell.
So Dr. Prakash wants to say that voice is precious. It's a part of our identity and we have to preserve and maintain good voice. So that was our live phoning program, viewers. We have come to the end of the program. If you want to seek consultation with our experts, Dr. Prakash or Dr. Gopi Shankar, you can visit All India Institute of Speech and Hearing, MYSURU, located at Manasa Gangotri Naimisham campus. Or if you are unable to attend or come visit us in person, you can avail our teleservices. One of the modes is by logging on to our official website www.aishmysuru.in. There you can go to the right hand corner latest announcement section. When you scroll down, there is an option for you to take online appointment for teleservices. If you click on that link, you will be led to a Google sheet where you have to furnish the information on what is your problem and your basic details like your Aadhaar number and other things. Once you furnish all the details, you will be contacted by our professionals for appointment to tele-assessment or teletherapy services. Or you can also drop in a request mail to our official email ID aishTelecenter@gmail.com, which spells AIISHTELECENTER@gmail.com, with your brief note on what is the voice problem and the details like age and name of the child, so that we can contact you and give you appointment for teleassessment or teletherapy. With this information, I would now like to conclude the program by thanking our resource persons, Dr. T.K. Prakash.
Thank you.
And Dr. Gopi Shankar
Thank you.
for their information and for their kind time. Thank you all viewers. Thank you.